Good day and welcome to our training on Emergency Obstetric Care for Prime Care Nursing Practice. In the previous video, we defined emergency obstetric care as the urgent and life-saving response to serious complications during pregnancy, labor, childbirth, or shortly after delivery. We established that emergency obstetric care is important because early recognition and timely treatment can prevent many maternal and newborn deaths. We explained the 3 delays model as delays in seeking care, reaching care, and receiving care that contribute to maternal mortality. In this session, we will continue our discussion on foundations of emergency obstetric care. By the end of this session, the participants will be able to 1. Describe the major causes of maternal death. 2. Identify early warning signs of obstetric emergencies and the signal functions of emergency obstetric care. 3. Explain the leadership, communication, and professional role of the advanced practice nurse during obstetric emergencies. 4. Recognize the importance of teamwork, respectful care, and facility readiness in emergency obstetric practice. We will start with discussing the major causes of maternal death and the early warning signs of obstetric emergencies. To save lives, we must first understand the primary threats. The major causes of maternal death are the conditions that most commonly lead to severe illness or death during pregnancy, labor, childbirth, or shortly after delivery. Other contributors may include unsafe abortion and serious medical conditions such as anemia, cardiac disease, diabetes, or other illnesses worsened by pregnancy. There are 4 critical emergencies every clinician must be ready to face. First, severe bleeding, specifically postpartum hemorrhage. A woman can lose a large amount of blood in a short time and go into shock if urgent treatment is not given. Second are hypertensive disorders of pregnancy, such as preeclampsia and eclampsia. These conditions can lead to very high blood pressure, seizures, stroke, organ failure, and death. Third is sepsis. This is a severe infection that spreads in the body and can quickly become life-threatening if not recognized and treated early. And fourth, obstructed labor. When labor does not progress and the baby cannot pass safely, the mother can develop exhaustion, uterine rupture, infection, bleeding, and fetal compromise. Because these conditions are so dangerous, we must be vigilant for early warning signs. These early warning signs of obstetric emergency may include heavy bleeding, severe headache, convulsions, prolonged labor, high fever, foul-smelling vaginal discharge, difficulty breathing, severe abdominal pain, confusion, unusual drowsiness, weakness, collapse, or signs of shock. In simple terms, these are danger signs that tell the clinician that the woman may be getting critically ill and needs immediate attention. Obstetric emergencies do not always begin dramatically. Sometimes the earliest signs are subtle. Fast recognition of those early warning signs can make the difference between recovery and death. Beyond recognizing danger signs, we must look at the signal functions of emergency obstetric care. The signal functions of emergency obstetric care are the key life-saving services that a health facility should be able to provide during obstetric emergencies. They help determine whether a facility is ready to manage major complications safely and effectively. In simple terms, the signal functions show whether the facility can actually respond when a woman develops a serious complication. They move emergency care from theory into real practice. The advanced practice nurse plays a major role in making this care work. The advanced practice nurse is expected to recognize emergencies early, begin urgent action, coordinate the team, communicate clearly, support documentation and referral, advocate for readiness, and ensure that respectful care is maintained even during crisis. Emergency care is categorized into two levels. First, there is basic emergency obstetric care. It includes essential emergency actions such as giving antibiotics, oxytocin, and anticonvulsants, manually removing the placenta, removing retained products of conception, and performing assisted vaginal delivery. Then we have comprehensive emergency obstetric care. This level includes all of the basic functions and adds the ability to perform cesarean section and provide blood transfusion. The signal functions of emergency obstetric care are more than just a checklist. They are practical indicators of whether a health facility is truly prepared to save lives. And it is the advanced practice nurse who helps turn that preparedness into action. We have come to the end of this session. In summary, we outlined the key conditions that commonly lead to maternal death during pregnancy and childbirth. We highlighted that even subtle danger signs can indicate rapid deterioration and require immediate attention. We showed that effective emergency response depends on facility readiness and strong clinical leadership. Thanks for watching. See you in the next session. Bye for now.